The ketogenic diet, long recognized for its benefits in weight management and metabolic health, is now emerging as a promising therapeutic approach for severe mental illnesses such as schizophrenia and bipolar disorder. A groundbreaking study conducted by Stanford Medicine suggests that this dietary intervention can lead to significant improvements in both metabolic and psychiatric health in patients undergoing treatment with antipsychotic medications. This discovery offers new hope in the field of psychiatric care, where treatment options often come with significant metabolic side effects. Mental illnesses like schizophrenia and bipolar disorder are typically managed with medications that help regulate brain chemistry. Yet these drugs often bring about substantial metabolic disturbances, including insulin resistance, obesity, and increased risk of cardiovascular disease. These complications can be so severe that many patients choose to discontinue their treatment, leading to relapses and worsened health outcomes. The potential of the ketogenic diet to counteract these metabolic side effects while simultaneously improving psychiatric symptoms presents a compelling case for integrating nutritional strategies into mental health treatment. The Stanford study involved a 4-month trial with 21 adult participants diagnosed with schizophrenia or bipolar disorder who were taking antipsychotic medications and exhibited metabolic abnormalities such as weight gain, insulin resistance, or high blood sugar. The participants followed a well-structured ketogenic diet where approximately 60% of their caloric intake came from fats, 30% from proteins, and only 10% from carbohydrates. Unlike conventional dietary interventions that emphasize calorie counting, this approach focused on altering macronutrient intake to induce ketosis, a metabolic state in which the body burns fat for fuel instead of glucose. Participants were provided with keto-friendly meal guides, access to a health coach, and regular monitoring of blood ketone levels to ensure adherence. The results of the study were striking. Patients adhering to the ketogenic diet experienced a dramatic reversal of metabolic syndrome, a condition defined by obesity, high triglycerides, low HDL cholesterol, high blood pressure, and elevated blood sugar. At the beginning of the study, nearly 30% of participants met the criteria for metabolic syndrome, but after 4 months, none did. On average, participants lost 10% of their body weight, reduced their waist circumference by 11%, and showed significant improvements in blood sugar levels, blood pressure, insulin sensitivity, and triglyceride levels. These changes not only improved overall health, but also reduced the risk of long-term complications associated with metabolic disorders. More importantly, the study found that the ketogenic diet had profound effects on psychiatric symptoms. Using clinical rating scales, researchers observed that schizophrenia patients experienced an average 32% improvement in symptom severity, while 69% of bipolar disorder patients reported a meaningful clinical improvement. Participants also reported enhanced energy levels, better sleep quality, improved mood, and an overall increase in life satisfaction. The study suggests that the ketogenic diet may not only stabilize mood and cognitive function, but could also reduce the severity of psychiatric symptoms, offering a valuable adjunct to traditional treatments. One of the key mechanisms behind these improvements lies in the diet's impact on brain metabolism. The ketogenic diet shifts the brain's primary energy source from glucose to ketones, which are more efficient and provide a steady fuel supply. This metabolic shift is particularly relevant for psychiatric conditions, where impaired glucose metabolism and mitochondrial dysfunction are believed to play a role in symptoms. The study's lead researcher, Dr. Shabani Sethi, coined the term metabolic psychiatry to describe this emerging field, which explores how metabolic interventions can influence brain function and mental health. There is also growing evidence that psychiatric conditions may originate from metabolic deficiencies in the brain, affecting neuronal excitability and energy regulation. Just as ketogenic diets have been used successfully to treat epilepsy by stabilizing neuronal activity, they may offer similar benefits for mood and psychotic disorders. The ability of ketones to enhance mitochondrial function and reduce neuroinflammation further supports the idea that ketosis can improve psychiatric outcomes. Another advantage of the ketogenic diet is its potential role in gut health, which has been increasingly linked to mental health through the gut-brain axis. A well-balanced gut microbiome plays a crucial role in neurotransmitter production, inflammation regulation, and overall brain function. By reducing sugar and processed carbohydrate intake while increasing healthy fats, the ketogenic diet may support a healthier gut environment, further contributing to its positive effects on mental well-being. While this study was a small pilot trial, the findings are compelling enough to warrant further research on a larger scale. The high adherence rate among participants, along with the observed benefits, suggests that the ketogenic diet could become a viable therapeutic option for individuals struggling with severe mental illnesses. For patients who often face limited treatment options and significant medication-related side effects, the prospect of using a natural dietary intervention to improve both metabolic and psychiatric health is an exciting development. The implications of these findings extend beyond just schizophrenia and bipolar disorder. Given that many neurological and psychiatric conditions share common metabolic dysfunctions, the ketogenic diet could potentially be beneficial for other disorders, including depression, anxiety, and even neurodegenerative diseases such as Alzheimer's. The ability to provide an alternative energy source for the brain, reduce oxidative stress, and modulate inflammation makes keto an intriguing candidate for future research in mental health treatment. Incorporating dietary strategies like keto into psychiatric care represents a shift toward a more holistic approach to mental health. Instead of solely relying on pharmacological treatments, integrating nutrition-based interventions could empower patients with additional tools to manage their conditions effectively. As more research emerges, the ketogenic diet may become a key component of personalized mental health treatment, offering a new level of control and hope for individuals facing chronic psychiatric conditions.